Coping with COVID-19, brought to you by Guardian Group. Live easy.
And we are back on the Coping with COVID series that we've started since last week. And of course, Dr. Erica Wheeler has been with us from day one. And we have so many questions, and we have more for her again this morning. Good morning, Dr. Wheeler.
Good morning.
And Dr. Wheeler, of course, is the country representative for PAHO and the WHO for Trinidad and Tobago and the Dutch Caribbean Islands. Dr. Wheeler, we're going to jump right in. There is an article that's been circulating on social media from about the middle of March, but it keeps popping up. I saw it again this week, that the WHO is saying that COVID virus is now airborne. Can you please clarify that, bring some truth or dispel it accordingly?
Okay, so thanks for the opportunity to talk about that, because yes, it has been going around. The truth is we have no evidence that it remains airborne. We spoke before about the fact that if you cough or you sneeze, the droplets, which are relatively heavy compared to air, would fall to the ground.
Mm-hmm.
And that's why the advice is to stay at least 3 feet away from the person nearest you, because that's the distance on average that the droplets can reach when you sneeze, certainly when you sneeze.
Mm-hmm.
That bit about the droplets remaining in the air, that refers specifically to when patients are in hospital and they're being given certain treatments that generate the particles. It's called aerosolized treatments.
Mm-hmm.
So it is really about hospital, and the warning should be for health workers in hospital to ensure that they're properly masked and gowned and so on. So it remaining airborne for any length of time does not refer to the average person coughing or sneezing. That definitely refers to hospital treatment.
I'm glad you cleared that up, because we did interview a nurse yesterday from the United States, and she was in fact speaking about medical workers and the fact that it can hang in the air. I guess she wasn't using the term that you're using right now, but I guess persons could misinterpret that to mean that it hangs in the air even in their homes or in public places.
No, it does not. There is no evidence that it does. And of course, we're studying many cases from China, because we're learning all the time. We're learning from China, we're learning from what's happening in Italy, and we're taking precautions. So yes, it does refer specifically to hospital situations, because to treat persons with pneumonia, you have to use some of those treatments that generate little particles during the treatment, and those are the ones that health workers must guard themselves against with the proper what's called personal protective equipment,
which we see coming up as PPE.
PPE, exactly. Yes, that's the short term for it.
Okay, so you mentioned keep 3 feet apart. So I've heard 3 feet. Some countries are saying 6 feet 2 meters, as is the case in the United Kingdom. What is it exactly?
Well, the 3 feet, it's because when you sneeze or you cough, that's the distance that the droplets on average reach. There's no harm in being further away, but the 3 feet is the distance that was recommended. If you're 6 feet away,
it's even better.
It won't do you any harm to be 6 feet away, but the 3 feet is simply because of when you cough or you sneeze, that's how the
But some people don't even know what a foot is or a yard is or 2 feet it really is. And you're actually seeing people even in closer proximity when they're shopping and so on. So any advice as to how do you get around getting people to stay 3 feet away?
3 feet apart. Yeah. I think we have to be very conscious. First of all, we should measure it in the privacy of our homes.
Right.
What on average is 3 feet. But we just have to be more intentional about it, because we are not used to social distancing. It's not something that we do on an everyday basis. So I would say when you're in the privacy of your home, you measure on average what's 3 feet, what's 6 feet, and then when you are in public, then you can average it and remind yourself.
So we're seeing that in Trinidad and Tobago now that there will be an increase in testing. How does increasing testing help the whole process?
Oh, that's a really excellent question. At the beginning of an outbreak like this, what we see and what we saw in China and what we're seeing in Italy is that you need to be able to identify as soon as possible those persons who are exposed, because for every one person who has the virus, they can infect on average 3 other people.
Mm-hmm.
So in the course of a day, depending on how many people you interact with, you can infect many, many people. So therefore, it is important once an individual is identified, all the persons with whom they've been in contact must also be identified. That's contact tracing, and they must all be tested.
Right.
And those persons, if they were in contact with other people before they have been tested, you have to identify who those people are and test them. So the range and the number of people increases. So therefore, you must have the test. You can't wait until those people become symptomatic. What they will need to do is to be self-quarantined. So
Yes.
they're identified, first of all, through contact tracing, and then they should self-quarantine in their homes. And we need to be clear about self-quarantine in your home. What you do is you don't mix with other members of your family. You're in a room of your own. You stay away from people, the required distance. You have your own plates and cups and saucers and so on. So you don't mix, because self-quarantine means that when you're in your home. It doesn't mean that you move about freely
Yes.
and
What if
interact.
there's just one bathroom in the home?
Well, then you will have to have a schedule as to when you use the bathroom, and certainly everything must be cleaned right after you use the bathroom, all the proper hygiene, you know. If you don't have the regular commercial cleaning things, you can use 5 tablespoons of bleach in a gallon of water.
Okay.
Okay, so the bleach is much easier to get hold of, because lots of commercial disinfectants and so on are being cleaned out. So again, paying attention to wiping down the sink and the toilet, and cleaning out the bathroom and so on. So it has to be a routine. We just have to be more intentional about cleanliness, because the virus breaks down very easily. The outer coating, once you wash your hands or there is bleach or disinfectant, it is a fragile virus. So the outer coating on it breaks down very easily. So that's why we keep advising that people wash their hands, clean surfaces, and so on. So you will have to work out a routine. The family will have to work out a routine
Yes.
and stick to it, because of course everybody's situation is different.
Speaking about routine and everyone's situation being different, I know of persons who say as soon as they get home, some people leave their shoes outside, for example, they take off their clothes, they wash their clothes every day, they have a shower, especially if they're living with someone who's vulnerable. What does the WHO recommend?
Well, that's good practice. I mean, that certainly is what we recommend for health workers.
Okay.
As soon as they come home, they take their clothes off, take their shoes off, and they have a shower. So, there's never anything wrong with cleanliness, never ever.
But they're saying, in addition to doing that, they wash every day. So they wash their clothes, they put what they wore during the day to wash immediately, so that they keep that cycle going, as opposed to, some people might have put the clothes to hang up and wear it another day later on, or so on. They're saying that now they have to get into that routine because they're coming from outside and they feel uncomfortable just bringing stuff into the home.
Well, you have to think of the context in which that advice is being given. When there is a high level of community transmission, you have to be more vigilant. So every country is not the same, and it depends on the environment which you're in. If you're in a closed office environment and there's no reason to be concerned, maybe we don't have to be, that vigilant. But certainly you're hearing information from countries where there is widespread community transmission.
Yes.
And therefore, you have to be cautious. We do know that the virus can live certain periods of time on different surfaces, plastic and steel. Maybe you can clean it easily with disinfectant and it will disappear. It may remain a little bit longer on fabric or cardboard. But again, we have no proof that, the virus would linger for weeks or anything like that.
Yes.
But when you are in a situation where there's high community transmission, you do have to take more precautions.
Right.
And there's nothing wrong with
Which is
doing
what we're
those
seeing in the
things.
UK, for example. The UK has gone on complete lockdown now.
Yes.
As the Prime Minister Boris Johnson said yesterday, no more than 2 people. They can go out just once a day for exercise, only for essentials, groceries, and pharmaceuticals only. And there is a fine if you break the law. Is it that I'm seeing more and more countries moving to closing borders and so on? remind us, is this in keeping with the WHO guidelines that the countries would be following?
Well, what it is in keeping with more is what we observed as WHO, what happened in China. Because China, very early on, they went into lockdown, they stopped transport, and it is about, you know, the virus is contagious. So therefore, what they did was stop people from being in contact with each other. This is the underlying motive. Sometimes when you have high community transmission, as you did in China, the social distancing alone and leaving it up to individuals was not enough. So they had to impose extreme measures. And now in Italy, if you were observing, you would see that the number of cases, even in the last few days, has come down since they have instituted stricter measures around movement. So it is all in an effort to suppress the spread of the virus. The last time I was here, we were talking about flattening the curve, right?
Yes.
And that is really what it is about. It is, we know that the virus is here with us and it will spread across the world. But what we're trying to do is, instead of having those sharp peaks, to ensure that there are lesser cases. So we have to take measures to suppress the spread of the virus. And that's the reason for it.
We have a few more minutes. We never have enough time for these interviews, but the good news is that you're here with us at least once a week as we navigate ourselves through this situation. Let's talk a bit about the young people, because before you were hearing, you know, the vulnerable would be the elderly and those who have underlying conditions. But with the vast amount of young people recently in this past weekend in spring break in Florida, concerns were raised that, you know, young people, it does not mean that you are invincible, and that there are cases of younger persons who have contracted the COVID-19. Speak to the young people. What do you would say?
So yes, it is true. Young people are not invincible, and yes, they are. It is just that they get it at a much lower rate, and in terms of recovery, they recover faster. So the message is twofold, really. Yes, if you are older, you are more vulnerable. If you have an underlying illness, we're seeing in Italy most recently that the vast majority of people who died were between the ages of 80 and 85, similar to China. But at the same time, yes, there are younger people who get COVID-19. There's no question. What we are saying is, for them, it might be very mild. And there was a study done recently on 55,000 patients that in WHO we are aware of, and 2% of them were children. So yes, children can get it, young people can get it, but they tend to rebound more easily. It doesn't mean that none of them will ever get severely ill, because we are human beings and we respond differently to any disease that we get. But still, by and large, it is true that older people are more vulnerable, but please, younger people can be carriers.
Yes.
They can be carriers, and they can give it to their grandparents, their aunts, their uncles. So there is a message for younger people that you should stay away. If you're not well, you should stay away from your elderly relatives, because you can give it to them. You may have a sniffle, or you may feel unwell for a few days and you may not know you have it, but you can give it to older people who will then become ill. So no, young people are not immune from it. It's just that their immune system is stronger, and therefore they can recover quicker, or they may not have a severe symptom.
All right, and Dr. Wheeler, on a lighter note, can you wash your hands too much? Because, you know, we are washing our hands very often. Some people are accustomed to washing your hands and using the moisturizers to keep your hands nice and moist. But then you tell yourself, why waste the cream or the moisturizer, right? Can you wash your hands too much? Is it possible to overwash your hands, dry out, you know, with the skin? And does it affect you in any way? What should you do otherwise?
If your skin is beginning to peel, you should not wash your hands
wash
to the
it too much right now.
It damages the top layer of your skin, because that's not good for your skin either.
Right.
But certainly you can use, in that case, in between hand washing. If you are when your hands are soiled, you must wash them. Don't use hand sanitizer. Soap and water kills viruses. So you do that. But don't wash your hands to the extent where you damage your skin, because that is not a healthy thing to do, to damage your hands.
Thank you, Dr. Wheeler. It's always a pleasure. We're going to see you here next week, Tuesday, once again. For every day, there's something that puts us in a position where we want to know more about this COVID-19 virus. This brings us to the end of our very first interview in our series of interviews bringing the information to you with regard to COVID-19. And thank you so much, Guardian Group.
Coping with COVID-19, brought to you by Guardian Group. Live easy.